Welcome to Feminine Roadmap Podcast. I'm your host, Gina Farrar. Each week, I bring you an inspiring conversation to help you navigate the challenges and changes of midlife so that you can not only survive, but thrive in your second half. Hello, Feminine Roadmappers. It is Gina here, and today we have a great topic. We are going to be talking about myths about heart health. Today I'm talking to Dr. Shah. He is a cardiologist. A nuclear cardiology and electrocardiac physiology are his specialties. He is the author of Heart Health, a guide to tests and treatment you really need. We're going to be talking about some of the myths of cardiology, that more testing is necessary, that surgery is better than meds. There are so many things he's going to be sharing with us. So I encourage you to grab a pen and paper and take some notes. Let's welcome Dr. Shah to the show. Welcome, Dr. J.
And thank you very much for having me on the show, Gina.
It is my pleasure. And I wanted to start off with your history, a little bit about who you are, what led you to go into cardiology, and why did you write this book?
Sure. So the reason why I went into cardiology is because a lot of my family members had heart problems. And I remember being 10 years old in India. My grandfather was admitted to the ICU with a heart problem. And I had to finish some homework. So my parents said, you stay with grandpa. You're not allowed to go in, but you can sit outside just in case he needs something, but you do your homework. And I'm sitting there and one of the doctors comes along and he kind of just chats up with me and says, what are you up to and what are you doing and all that. And I said, I'm doing my science homework. Like, what do you want to be when you grow up? And on the spur of the moment, I said, I want to be a cardiologist when I grow up. And that stuck with me. I have no idea why that impacted me so much, but that stuck with me that, yes, I told him I want to be a cardiologist and that's what I'm going to be. And so that's how it came about. Over the years, I've had the good fortune of training at some fantastic places. I went to medical school in India and then came to the US and trained in the methods of research, understanding research better so that I could conduct some of my own research. And then I got trained in internal medicine, followed by cardiology, and then in the heart rhythm problems. And then after I graduated, got all my board certifications, I've been really fortunate to have been able to work in different parts of this country, in rural settings, urban settings, suburban settings. I've been part of university, I've been part of private practices, and I've also worked quite a bit internationally, back in my country, India, but also in Ethiopia. So I've had the opportunity to see practices all over, see patients all over, figure out how to interact with them, how to make them understand the basics of cardiology so that they can have meaningful participation in their own care. And that is really what I want to bring out for the rest of my career.
It's so important too, Dr. J, because I was sharing with you before I hit record that I'm currently, caring for both my mother and my mother-in-law, meaning that I don't live with them, but I do all of their doctor's appointments and everything. And recently we added a cardiologist to my mother-in-law's list of doctors. And I was really intrigued with how much care he took. He was reading all the paperwork. He'd never seen her before. And he was very, just the techniques, just the ability to really look at a piece of paper and honoring the fact that this person like you has done the work and they're trying to understand this one individual's heart. How does it work? And she has AFib. So now we have this new thing. And what does that look like? And so because these things become more important to us the older we get, right? Mm-hmm. Mm-hmm. I see you wrote this book about a guide to tests and treatments you really need. So how do we know? Because I'm literally starting this journey with my mother-in-law.
Right.
How do we know what we should be doing? Now, the doctor does his part, but what's our part in understanding our own medical health care for our heart?
So the basics, either before you have the heart condition or even after you have the heart condition, the basics are all things that you can do at home, which is quit smoking, exercise regularly, eat healthy. Those are the three essentials, and that applies before you have a heart condition, but even after you have a heart condition. So that's number one. Number two is, if you want to step up your game, then monitoring blood pressure and monitoring blood sugar. Those are the next step up. And then if you have gone through that, then you go to the next level, which is really interacting with your doctor as a part of the team. And by being a part of the team, what I mean is understanding the information and then figuring out, is this really what I want? So one of the examples I give is that if you wanted to buy a house, you go to the realtor, you don't just hand over a check and say, find me a house and I will move. You interact with that person, you tell them what your preferences are, they tell you what is available, what your options are, they lay out the menu, they tell you the good and bad of everything. And that's exactly how I would like patients to interact with their doctors. Understand the situation, and then understand you are the expert on you. You understand your situation better than the doctor does in terms of how you feel, what your philosophy is, and things like that. If you don't want to be part of the cookie cutter medicine or the protocol driven medicine, then you have to take the initiative and say, this is what I want out of life, and let's see how we can match it up. So that would be the next step. And so understanding what you want, but also then working with your doctor to understand what these tests are, how they can help you, how they cannot help you, what the alternatives are, and then make a choice. One of the things I say is, with heart disease, there are very few emergencies. When we go to a cardiologist, we think, oh my God, this is heart related. If I don't do anything about it, I'm going to die next week, or I'm going to have a heart attack. Like when you went to the doctor, you are thinking, she has atrial fibrillation and that is going to cause a heart attack. Well, Gina, atrial fibrillation is a problem of the electrical system of the heart. Heart attacks are because of the plumbing system of the heart. Just like an electrical failure will not lead to the toilet overflowing, the same way the atrial fibrillation will not cause a heart attack. And so some of these things, once we explain it to the patients, they go home relieved. They kind of feel like now they have some time to think about it and make some wise choice that works with their individual situation. And that's where participation and in a meaningful way with the healthcare system comes into play. And that is one of the things I'm trying to convey through the book.
It is very scary, when people start talking about the heart. So with my mother-in-law, I was trying to alleviate her fear. And she wanted an answer because that felt like that was going to make her feel better. And I'm sure you get this all the time.
Yes.
There's this patience with the process of letting the doctor understand what's happening with you. And doctors aren't God, like they don't know everything. It takes time, right, to understand each patient.
Right. And there are limits to our knowledge. We know what happens if I had a patient. What research shows me is that if there were 100 such patients, how many of them will have stroke? How many will have side effects from the medicine? How many of them will benefit from the medicine, and so on? So I get percentages of what happens in 100 if I had 100 such patients. But then what happens to that one individual? I don't know. I'm basing it on what will happen if I had 100 such patients. 30 of them will have an outcome like this. 10 of them will have stroke because of this. 15 of them will feel better with a pacemaker, and so on. Are you the individual that will feel better because of a pacemaker? In some cases, we know definitively, but in a lot of cases, we don't know definitively. So you have to kind of recognize that you really have to work with the doctor and also understand what is the information he's trying to give you with an open mind. Sometimes I notice that patients come in to my clinic with a lot of preconceived notion, and so sometimes I have to let that be aired out. And I said, tell me what you understand of this. And once they tell me that, I have opportunity to go over it piece by piece and eliminate some myths and bring in some understanding of the disease process. Otherwise, it becomes problematic because they never bring out their myths. But they have a preconceived notion, and then what I'm saying doesn't match up with them. And in our brain, we want to be in sync. We can't hold two ideas which are totally different and take both of them to be true. So I have to kind of work through that process. And that's where interacting in a meaningful way with your doctor is immensely helpful.
It's a bit like being a psychologist, isn't it?
Mm-hmm.
You know?
It is a bit of psychology. It's a bit of investigative journalism, if you will, because we have to go through everything, create that time frame which has already happened with you, right? She's been, for example, your mother has been going through this for the past 6 months. Now, as a physician, he has to go through it and say, okay, this happened, then this happened, and then this happened, and then also bring out some things that you may not have thought about. Well, let me ask you this: 3 months back when this happened, was she having any of such situation? So it's a lot of putting things together. And I always say a meticulous physician is 10 times more impactful than a physician with multiple degrees or multiple accolades. I would any day take a physician who is willing to spend more time with me, more time reviewing my chart, than a physician who is having multiple awards and is the head of the department or what have you. You really want a physician who is focused on you rather than focused on your disease. Your disease is a part of you, but you are bigger than your disease.
So, as a doctor, when a patient speaks to you, what way can they approach you to make you willing to partner with them? Now, you're inclined to do this work. Not all doctors are necessarily inclined to spend the time.
Right.
That's what I'm learning really fast. So, how can a patient approach a doctor to become partners with them?
So, what I would say is when you go in there, be willing to speak and feel like an equal. When I see patients, the first thing I notice is they speak with a certain amount of deference and reverence, and they think from my authority, I know all of it. So that's number one. Feel like an equal. Number two, don't assume that just because it is in the electronic records, the doctor knows about it.
There you go. Okay, so they may not have seen the information.
They may not have seen, or it may not have been put in appropriately. The other thing is, not all your doctors are on the same system. So what information there is in one system may not be available on the other system. So be willing to tell your story over and over again. in great detail. So that's kind of your part about it. Then also during the initial visit, see if your doctor truly is trying to understand you. Is he sitting down and interacting with you? Is he just standing, hovering over you, and ready to leave? If so, he's not really engaged in you, he's engaged in your disease process. And that should be a red flag. You want a physician who sits down, who asks you about your condition. Then also talk about your other health condition. Even if you are at a cardiologist office, of course you are going to talk about heart related stuff, and you should. However, after that, talk about your other medical condition. I have diabetes, I have high blood pressure, I have COPD, and 2 months back I got admitted for my COPD, and things of that nature. I've had one stroke or what have you, so that he understands the complete picture, so that he individualizes your care. And then when the doctor does tell you what is going to be done, that is when the next part of your responsibility comes in. That is where you say, what is this test for? Now, even if it seems very straightforward and plausible that this test will help you, I still would want you to ask this next question, which is, do we have evidence that a patient like me will be helped in terms of prolongation of life or improvement of the symptom? I know all of this sounds mouthful, so I will repeat it again. But what I would like you to ask is, all this makes sense. However, do we have scientific evidence that this test or procedure helps patients like me in prolongation of life or improvement of the symptoms? Because, Gina, that is what the ultimate goal of medicine is and should be. When you go in to get checked for atrial fibrillation, what your mother is really wanting to do is make sure she lives a healthy, normal, long life. If her EKG doesn't look pretty, that's not her concern. Her concern is, am I going to live a normal life? And am I going to live a good quality of life? And so any tests and treatments you do, is that helping it? And so if you, for example, in atrial fibrillation, we talk about these cardioversion, we will shock your heart back into normal rhythm. Yes, that would be good. However, it will bring my EKG into normal rhythm. Will it make me feel better than what I'm feeling right now? If so, this is a good test for me. If not, then maybe I should think about it a little more. Why am I going through this? So that is where your partnering comes in. Also, by saying, people like my health condition, what you're doing is you are getting the physician focused into your individual care. And then the next thing is, yes, I recognize that this is going to benefit me. Then the next question you ask is, what are the risks of this? If it is a medication, what are the side effects of this medicine? And if it is a procedure, what are the complications of this procedure? And if it is a test, then I want you to ask, what do we do if this test comes abnormal? What do we do if this test comes normal? And if you say, for example, and this is purely hypothetical, but if someone who is 85 years old, suffering from lung disease, has dementia, and is more or less bedridden, and you go in to the doctor's office and they say, we are going to perform a stress test. Okay. What would we do if it is positive? What would we do if it is negative? Well, if it's positive, then we will do a heart cath. Okay. If the heart cath is positive, what are we going to do about it? Well, we can do a bypass surgery. And you say, wait a minute, is this really appropriate for an 85-year-old who is bedridden, who is demented? Is that what we want to put him through? If not, then let's step back and say, why are we doing a stress test then? And that's the processing, that's the partnering that comes in. And every single time, this is what you want to understand. And so after you've gone through this process, you will come out much smarter, but also more able to make your individual choices. And what you will notice through conversations is this a physician who is willing to partner with me, number one, or does he want to just give me a prescription and walk away? In that case, Gina, second opinion. Most heart-related situations, unless you are in an emergency room with chest pain, shortness of breath, or what have you, outside of that situation, most heart conditions are not an emergency. You have enough time to go get a second opinion. Go across town to another cardiologist who is more willing to spend time with you and understand your situation better, because it should be your choice. And once again, I come to the same example of finding a realtor. And I do not by any means, I'm not trying to devalue what doctors do. However, I do not want patients to be devalued either. I want them to be equal partners. And if a doc is just handing you down, go do this test and go do that test, I don't think that will be effective. And we know this through ample scientific evidence. Physicians who care about their patients, who individualize the care, actually do tend to have better outcomes.
Yeah, that's interesting. Thinking about the idea that we do have the right to speak our mind, and it is okay, give ourselves permission to push back a little if something makes us uncomfortable.
Absolutely. One of the things is that a better doctor will actually be welcoming of you getting a second opinion. If your doctor is not welcoming of a second opinion, he has something to hide. I would not be comfortable with a physician who is so resistant of you getting a second opinion. And good doctors that I know routinely themselves think about this. And I've been in the field now after getting all my certifications and degrees. I've been in the field for about 12 years. And for complex cases, I would still call on my fellow physicians and say, how would you take care of this? This is a little complicated. And I get a second and third opinion myself. So I cannot imagine a doctor who cares about you will be opposed to you getting a second opinion.
So when we look at all of the things that are scary, which is pretty much everything with heart health, right?
Right.
And I think people want to avoid heart doctors because we want to avoid the scary conversations.
Yes.
But your book is about getting a guide to understanding which tests and which treatments you really need. So why don't you begin to share some of the myths that you shared with me before we hit record, and let's talk through some of those things that some people might be afraid of or think they know that may not be true.
Absolutely. So let's start off, and this may be a longer answer, but let's go through it because I think it's very critical. The first myth that I want to talk about is more cardiac testing is better, and it can give me a jump start on tackling the disease. Now, if you are having symptoms which your doctor believes could be heart related, has a good possibility of being heart related, then it is helpful to get these tests to confirm the doctor's suspicion of heart condition. If you are having chest pain, either with exertion or at rest, you are a smoker, you have diabetes, you have high blood pressure, or you have family history of heart condition, you are above the age of 65, then yes, those tests will definitely be helpful. But you are very healthy, active, everything has been going great. And you go for this welcome visit when you become a Medicare age patient. You go in and the doctor says, well, we will go ahead and get a stress test. That is a problem. And I can tell you lots and lots of stress tests in this country are done along those lines. You want to get a colonoscopy and they want to do a stress test before that. You have no symptoms. You've been walking, you've been hiking, you've been running, you're active, you have no symptoms, but they want to do a stress test. That's a problem. And American College of Cardiology, American Society of Nuclear Cardiology, all of them have come out and said stress tests should not be done under these circumstances. They lead to more harm than good. And it is unfortunate that these continue to be part of the norm, part of the day-to-day cardiology testing. And so that's the first myth. And if you are healthy, active, exercising, what comes out of that stress test is more likely to harm you than help you. And that is why all these professional societies are asking cardiologists to refrain from that. So that's the first myth that I wanted to bring out. The second myth that I want to bring out is anything wrong with the heart needs to be fixed immediately. There is a certain sense of urgency. We need to fix this. And that once again holds true. If you're having chest pain at rest, which doesn't go away, you're short of breath, you go to the emergency room, they get an EKG and they tell you you are having a heart attack. At that point in time, emergency care is needed. Outside of a situation like that, it's not an emergency. Blockages in the heart arteries evolve over years and decades. When we have done autopsy on young veterans, people who have died of non-natural cause at a young age, whether it's motor vehicular accident or what have you, even at the age of 35, 10 to 20% of patients will have blockages in the heart artery.
Interesting.
So the blockages that you have evolved over these years, over these decades. They did not come up yesterday. So just because it is detected today doesn't mean it's a super urgency to fix it. Patients routinely have 50, 60, 70% blockage, and they live a perfectly normal, healthy life through that. However, when we are being told of that, all of a sudden we feel this urgency to fix it because that's human nature, right? We want to act, we want to do something about it. How many times, Gina, have you sat in a traffic and Google Map tells you this is still, despite the traffic, this is the best route and stick with it. But you have the urgency to do something and take another route, even if it is longer. And that's exactly how our minds work, right? We want to act on it. We want to do something. Don't just sit there, do something about it. That's what we've been told. However, what I'm trying to say is that this is a time to pause and talk with your doctor about, is medication an option? Can we not rush through this? What will be the outcome? If we try medications first, can I get a second opinion before I am being rushed to an urgent bypass surgery? I think all these questions we need to ask. So it's a myth that anything wrong with your heart needs to be fixed immediately. So that was the second myth. The third thing, now that we are on to this rhythm, the third myth I want to talk about is surgery and procedures are always better and more definitive than medicine. And I'm here to tell you that is just not true. In many, many cases, medications will provide as much benefit as procedures and surgeries will. So, for example, in patients who have all their three heart arteries blocked, we know from data that if we give appropriate medicine, they will survive on an average for 88 months. That's about 7.5 years. On an average. And then on an average, if the same group goes through surgery, they will survive for 94 months, right? It's a difference of 6 months. So is it meaningful difference? Absolutely, it is meaningful difference. Is it overwhelmingly better? No, it is not overwhelmingly better. So that's what I want to bring out, that surgery is better in this case? Yes. Is it over and beyond better? No. And the same thing with atrial fibrillation. We have these procedures called ablation, and we have been doing this, and I do these procedures myself. However, I sit down and talk to the patients and tell them that these procedures are no better than medicine. We have data almost as recently as last year, and we are not finding that our procedures are doing any better than medicine are. So that's where having that conversation and not just going with, well, it makes sense that surgery is better than medicine. It doesn't always hold true. Then more specific myth that I want to bring out is stents. In an emergency situation, once again, when you're having chest pain, shortness of breath, having a heart attack based on the EKG, yes, a stent will save your life, prolong your life. However, under every other circumstance, stents are no better than medicine. And there is ample scientific evidence to this dating back to 2010. We have now known about this for almost a decade. And so when patients are asked, do you think this stent saved your life? All of them believe it did. And the truth of the matter is, we have no evidence that stents are prolonging lives or protecting you from a fatal heart attack. That is accomplished much better with medications than with stent. And so those are the 4 specific myths. And then I'm going to bring out a very sore topic that we don't like to talk about, which is that the myth that the only reason a doctor prescribes tests and suggests surgery is that it is good for me. And the reason why I say we don't want to talk about it is because I have recognized over the years that patients are thinking about it, but they don't want to bring up that doctors are motivated by economic considerations. These tests and treatments are bringing hospitals and doctors 10 and 20 times more money than what a meaningful conversation will do. When I sit down for an hour with a patient, the most that a doctor will make is $250, $300 for that visit. In the same hour, if he is doing procedures, that can make 10 times as much money for the patient as well as for the doctor as well as for the hospital. And so there is that rush to doing the procedure rather than this going through the conversation and prescribing medicine. So that's something that we have to keep in mind. The second thing is that medical legal considerations in our country are also a factor to be taken into consideration. Doctors sometimes do all the tests so that they don't miss a diagnosis. And though it may put the patient through down this rabbit hole of more testing and more testing, for the doctors, they are protected because of this. So when the doctor says that we go through these tests or procedures, I want you to have the skeptic's hat on and ask all the right questions so that you know that this is being done for the right reason. So let me just summarize. I know I've spoken quite a bit, but let me just summarize the 5 myths that I talked about. The myths are: more cardiac testing is better. That's a myth. The second is anything wrong with the heart needs to be fixed immediately. That's a myth. Stents save patients from near certain death. That's a myth. Surgery and procedures are always better and more definitive than medicine. That is a myth. And then number 5, the only reason a doctor prescribes the tests and suggests surgery is that it is good for the patient. It is true for many cases, but it may not be. And you need to do your due diligence to make sure that you don't go down the wrong path.
I feel like when you're in that situation, like for me, I'm the advocate for my mother-in-law because she does not advocate for herself naturally. And so I'm the one asking the questions. I'm the one. But how do we know what the right questions are? I do my best based on what I know is happening with her health, what has happened in this last hospital stay, what I noticed when, for example, she was in the hospital and she was in a care facility for something completely different than her heart. But that's when they found the AFib was in the hospital.
Right.
That one day I was there every day, but I was never there when they gave her medications, and they held back medication. And I said, why are you holding back medication?
Mm-hmm.
So then, oh, well, her blood pressure is low. Well, she's had high blood pressure. I've been with my husband since I was 18. She has always had high blood pressure. So I go on to high alert of, okay, something's happening. What did the doctor in the hospital change? And I do feel like, and maybe you can fix this myth, because we are talking about cardiology and heart health, but there's a lot of talk about the big pharma and about pharmaceuticals, because a lot of doctors, they just throw a prescription at you, and that bothers me, because I've been through that myself. I had a thyroid problem, Graves' disease, and I wanted to talk to the doctor. He would not talk to me. He kept writing me prescriptions. So I didn't take them, but I also didn't, have a second option. I don't remember now. I was really sick, so honestly, I don't remember all of the details. But it's frustrating because a lot of people want a quick pill, Dr. J. They want a thing that's going to fix it now. And let's talk about that problem of medication being the solution just because we think it's going to be like the magic pill, or the doctor's just shoving one at you and you feel frustrated and don't know what to do.
Right. And I talk about this in the book Heart Health, where I give an example of 2 friends. One is taking care of his health on his own and asking the questions, and the other friend, both of them are childhood friends, but the other friend is just eating what he wants to eat, not exercising, consuming a lot of alcohol, and then saying, oh, it's okay, I'll take extra insulin today, or I will go to the doctor and they will just fix it. We have a great heart program in our town. They take care of me. They're wonderful to me, and so on and so forth. And that's a problem, that we believe that there is a fix that medicine has for everything. Gina, let me give you one shocking number. In the 2000s, we did a study, and this is published. We did a study to see out of 2,000 different things that doctors do on a regular basis, how much of that is based on scientific evidence. 11% of what we do is based on scientific evidence. 11%. Wow. Unfortunately, among those, what we do know is exercise is scientifically proven to be better. The problem with that is that, number one, we have to take individual responsibility, and it's a day-to-day action, right? We feel like if I take this medicine and it's fixed, or a surgery, I put myself through this 3 hours and then I'm fixed. Well, all the surgeries will also work with medicine. So when we put in the stent, we still need the medicine. That's number one. Number two is, this is a lifelong process with whether it is exercising, whether it is controlling your blood pressure, whether it is controlling your blood sugar, it's a lifelong process. And we have to commit to it. When we say, my health is my number one priority, we have to mean it. It doesn't have to be empty words. When you say something is your priority, how much time are you spending on it? The other thing that I have started talking about is health literacy. How much time do we spend understanding our finances versus how much time do we spend educating ourselves on our health related situation versus how much time do we spend on sports or what have you, right? I mean, when we say something is our priority, we have to mean it. And so that's where I always tell my patients, healthcare is a process, not an event. It won't happen because I did the surgery and fixed you. It will happen because you committed to doing all the right things, keeping your weight under control, keeping your blood sugar under control, keeping your blood pressure under control, exercising daily, and so on. And that's where we need to transform our mindset about how do we interact with the healthcare system. And coming back to your experience with a doctor not willing to spend time, in majority of the hospital, you have the option of asking, even if you're admitted, you have the option of asking for a second opinion. If you don't feel like some doctor is spending time with you, be respectful, but at the same time, be assertive about it. I understand you're very busy and I respect that. You do have a lot of patients and I'm really sorry, but I would like more information. And I respect a patient who is willing to, because I feel like they're committed to their own health also. I'm more frustrated with patients who say, whatever you say, doctor. To me, that's a red flag, because I will never find out if they are committed to doing their part of the process. 90% of healthcare is at home. Home care is better than healthcare. What you do at home matters so much more than me writing a prescription or doing a procedure. Because at the end of the day, you and your caregiver have to make sure the medicine is taken appropriately. And if I don't have that trust, me writing the prescription makes no difference whatsoever if you're not going to take the medicine at home. And so that home care with exercise, blood pressure, blood sugar, and sticking to your medications matters a lot.
Yeah. Now, medicine on the whole, is it always necessary? And this is a very broad question, to have to take medicine? Because some people feel like if a doctor gives them a prescription, they have to take it. And I have not found personally that that's always the case, but I don't want to feel like I'm playing roulette either. But I think the mistrust came from the lack of communication. So how do we know medicine is the answer?
Right. So this is where asking the question about, do we have an alternative to this? Are there other things I can do before we start on a medicine? Is always a question. And that question about alternative should be discussed, whether we are talking about surgery, before we are talking about testing, and before we are talking about medicine. Is there an alternative? I have a close friend who has cholesterol issue, and when we were talking about this, he said, is there another option? And I said, yes. If you commit yourself to exercising 30 minutes a day, let's test you after 3 months and see how things are going. And I'm hopeful that he will avoid the medicine based on that. I won't say that if your doctor has given the medicine, you stop it. But before starting it, I would say ask the right question. And then please, please, please talk about your concerns with the doctor. If cost is an issue, bring it up. We always feel hesitant about it. For majority of the medicine, there are generic alternatives that doctors can use, equally effective. Just because something is a brand name, just because it's a newer medication does not mean it is necessarily better than a time-tested medicine that we've used for 30, 40 years. And so if those are the concerns, I know a lot of patients don't take the medicine because of cost consideration. If that's an issue, the solution may be to talk to your doctor and find out if there is an alternative. There almost always is.
I find that sometimes, like you said, they get offended when you question. So from a doctor's perspective, what I hear you saying is if a doctor gets offended, if a doctor doesn't partner with you, that may be a red flag that that's not the best fit for you. Not
Absolutely.
judging the doctor as a bad guy, but if you need and desire the partnership.
Yes.
And not giving into fear, really figuring that, I do have a say in my own health care.
Right.
And it's okay if you're telling me, Dr. J, that it's not immediate unless I'm in the hospital with heart pain, shortness of breath, and all of that I have time to find the solution. Is that what you're saying?
Absolutely. I'm so glad you summarized it so elegantly. And I hope that your audience has heard me as clearly and as crisply as you have, which is that you have the time. You have the time to understand your disease process and then choose what works for you. And by partnering with your doctor, once again, you're sitting down, understanding the situation, and then making a choice. And make sure you're not getting all confused with the medical terminology, because there is always a way to explain the same thing in a simple language, in a straightforward language. Before I released my book, I had tested it on fifth grade and sixth grade students. They understood it very well, and they understood what the core message was. So if they can understand it, and I can explain it in a book, then there is a way that your doctor sitting down with you will be able to explain in a simple language. Medicine, as complicated as we think it is, a good doctor will make it simple enough for you to understand, so that you can partner with them, so that you can ask all the right questions. My role as a doctor is to explain to you, show you all the options, and then you explain to me who you are as an individual, and then together we make a plan where you are the captain of this ship. You get to navigate how to go about it. My role as a doctor is to help you navigate it better. If you're going down a wrong path, I will stop you. But if you're going through alternative paths, I'm fine to partner with you on that.
So when you use the term navigation, I, of course, use that in my languaging for my podcast. So maybe one of the mindset shifts that I'm hearing is that we need to see it more of a process, something to navigate, as opposed to a problem solution.
Absolutely. Because that is what is leading to the current disappointment with the healthcare system. Because we think, I go to the doctor, he tells me what to do, I do it, I'm fixed. And then that doesn't happen, right? How often does that happen?
Not often.
Only in emergency situation. Outside of that, it doesn't happen. Then we feel betrayed by the medical system and disappointed. And that is what I want to refrain from.
It's such an interesting dilemma, because, like I said, doctors like yourself, other doctors that I've spoken to about other health things like menopause and things, there are doctors that genuinely care for the health of their patients. But the one thing that I notice is the ones that care take the time, just like you said.
Absolutely.
It's about the investment in the patient, not just trying to fill something into the chart and leave you with the nurse practitioner or whatever to answer your questions.
Absolutely. And that is the doctor you want to be working with. You do not want a doctor who is just going to tell you what to do next.
Yes.
That is the doctor who is willing to partner with you. And in the last chapter of the book, I talk about what is good for the patient, sitting down, talking to them, understanding their unique situation, their unique personality is not just good for the patient, it is also good for the doctor. It brings more meaning to their work. They are more engaged. That leads to less physician burnout. Currently, the physician community is facing so much in terms of physician burnout,
Yeah.
physician suicides,
Oh, wow.
alcoholism, and so on. So, what is good for the patient is equally good for the doctor. And that's one of the key elements. So, if you want a doctor who is meaningfully engaged, that will, you are also contributing to this building the culture of partnership in the healthcare community, because I think we will benefit from patients wanting to partner with us. Right now, even on the doctor's side, we face this problem that we want to partner, and either patients want to Google everything and run their own show, or not partner with us at all. And this has to be a teamwork. And that's really the key to getting better healthcare.
That's fantastic. Well, I know we're getting close to the end of our time, and you are a doctor, so I want to honor your time. So before we close out the show, I wanted to ask you, if somebody really kind of felt overwhelmed by this conversation, or they just are in the midst of their own medical journey, like I am with both of my mothers, what 3 things could you give them to kind of start their journey with confidence and to kind of eliminate that fear of medicine or doctors or whatever, to kind of overcome the mindset of us versus them? What kind of 3 things could we do to begin a healthier journey with our medical process?
Absolutely. So the 3 things I would tell patients and caregivers to recognize are: number 1, majority of the healthcare is what you do at home in terms of managing your weight, managing your blood pressure, managing your blood sugar, quitting smoking, exercise, all the good things that we talk about. So number 1 is that, taking care of things at home. Number 2 will be willingness to understand and committing to understanding the disease and its ramifications rather than getting anxious over it. Knowledge is power. So understanding that. And number 3 is talking to the doctor, understanding not just the test, but how is it going to benefit you in terms of prolonging your life and improving your symptoms. That is the key element, what we, all of us, are chasing: living longer, living better. So how is this test going to make me live longer and live better? So let me repeat the 3 things just to summarize. Number 1, taking care of the home care part of healthcare. Number 2, committing yourself to understanding the disease rather than just being anxious over it. And number 3, understanding how this test and treatment will prolong my life or improve my symptoms. Those 3 things will help you live better and live stronger.
Wonderful. Well, Dr. J, I want to thank you so much for taking time out of your busy schedule to share such an important topic with people, because right now, as we're having this conversation, there's a huge problem with, like you said, physician burnout, but as well as people not trusting doctors. So I appreciate that.
Yes, thank you for the opportunity, Gina. I really enjoyed talking to you.
It is my pleasure. Today I've been speaking with Dr. J. Shah. He's a cardiologist, and he has written the book, Heart Health, a guide to tests and treatments you really need. I really encourage you, if you are a caregiver or you yourself are trying to work out your medical process and what you need, please grab a copy of this book, share it with someone you love, and head on over to www.feminineroadmap.com/episode 125. I will have a link to that book so that you can get to it quickly and you can share this life-giving information, because we need to be partnering with our doctors. We need to take control of our own health care, not be victims, but to really be an important part of what we're going through. So I highly encourage you to get involved with that, get that book, share that information, and while you're at my website, join my tribe. When you listen to the podcast, please subscribe and share, because this information could literally make someone's life 150% better than it is today. Let's remove the fear from healthcare. Let's become partners with our doctors. And thank you so much for listening today, friends. I look forward to sharing more and more incredible guests with you in the future. I appreciate your time as well. Have a wonderful week, and until we talk again, take care. Bye-bye.